is Dr. Jeffrey Swanson, and he is a professor in psychiatry and behavioral sciences here at Duke. He received his MA from Yale and his PhD from Yale as well, and he is going to present to us today about mental illness, gun violence, and the law. So welcome, Dr. Swanson.
Good afternoon, everyone. Thank you all for sticking with us and for being here. And thank you very much for the invitation to come and speak today at this important forum for law and social change. So the topic of my presentation is a public health law perspective on gun violence and mental illness. So we're going to be talking about gun violence, firearms-related injury and mortality, and serious mental illness, how those two population health problems are related to each other, how they're not related, what we know about that scientifically, what we don't know, and maybe more importantly, what we might think we know that ain't so, and how we might use that scientific understanding to find our way to balance risk and rights towards more effective, equitable, and evidence-based policies. Let me begin by making a kind of a point about crime, some international comparisons of crime victimization. What you see here in this bar graph are estimates of the 12-month prevalence of being a victim of a crime in many different countries. So you can see the different shades there are different years: 1988, 1991, 1995, 99, and 2003, 2004. What's really remarkable here is just how average the United States is. The average across all of these different countries and years is about 16% of the population would report being a victim of crime within a year. And the United States is 17%. So we're just right about average, what everyone else is. Now let me show you another problem. This is a subset of crime. These are rates of homicide, and each of these dots represents a country. I'm not going to tell you just yet which ones they are because I'm going to put the names on there for a dramatic effect in a minute. And these are average homicide rates in 44 countries per 100,000. So just imagine that you live in a town, a city the size of Wilmington, North Carolina. That's about 100,000. How many times would you expect to read in the newspaper about a murder, about a homicide? Well, if you live in these countries here, Norway or Sweden or Germany, Portugal, Australia, Canada, you'd expect to have about 1 or 2 homicides each year. Now, these countries here are a little higher: Chile, the Philippines, the Dominican Republic, and here's the USA, right up here, at about 8 per 100,000, several times higher than some of our peer high-income countries. Now, you know, we don't totally win the contest. Colombia, El Salvador, Mexico, and Venezuela have higher rates. So here's a paradox. How can it be that we're just really average in our overall rate of crime victimization, but we're not average, we're way above average in our homicide rate? Well, it has something to do with our somewhat unique relationship to firearms, to guns in this country, because it turns out that in the United States, the percent of all assaults that use a gun is about 3 times higher than other countries, and the case fatality rate when a gun is used to try to harm someone is very high. So it has something to do with firearms. And here's a kind of a pretty dramatic demonstration of the association between firearms at the state level and the firearm fatality rate. So what you see here is a scatter plot, and over there on the vertical y-axis is the firearm fatality rate per 100,000 as reported by the CDC. And on the horizontal x-axis, that's the household gun ownership rate in each state. So what percentage of the households in these states have firearms? So you can see there's kind of a linear correlation. The higher the percentage of households that have guns, the higher the the fatality rate in that state. Just to put this in perspective, we have all probably visited the Vietnam Memorial on our National Mall, and so you know what a sobering sight it is to contemplate 58,226 names carved in a granite wall. That's the number of United States military personnel who died in the Vietnam War over a 10-year period of time. But I'd like you to imagine, what if we were to build a memorial to commemorate all of the people who have died in the last 10 years in this country as the result of a gunshot? If we did that, we would need a monument 5 times larger than the Vietnam Memorial. 306,946 people have died as a result of a gunshot in the 10-year period of time between 2001 and 2010. Now, 39% of those are homicides. 57%, the majority, are suicides, people who used a gun to end their own life. And 4% are other law enforcement actions or unintentional accidental firearms deaths. We live in a country that celebrates guns, has domesticated guns as a part of our culture. We live in a country where gun ownership, private gun ownership, is represented by very powerful corporate interests and political interests. And we have a heck of a lot of guns in this country, 310 million firearms in private hands. And there is an association between our guns and our population health problem of gun violence. So what do we do about that? You know, what do we do as a policy to try to reduce this problem? Well, it might be nice if we had a blank slate. If we could just start with a blank slate of paper and let's just do what works. Let's do what maybe some of our peer high-income countries do. And if we did that, we might say to ourselves, well, you know, the idea that everybody should be able to have a handgun for their personal protection, that's just too dangerous. We're just not going to allow that. So let's broadly limit legal access to guns. That's what some countries do who tend to have lower fatality rates than we do. But that's not the country we live in, as you all know. We live in a country where owning a gun is a constitutionally protected right, as decided in the United States Supreme Court decisions of D.C. versus Heller that struck down the D.C. handgun ban. It was extended to the states in McDonald versus Chicago, and basically the court decided that the Second Amendment of the Constitution confers an individual right to keep and bear arms, albeit not an unlimited right. And so there's a little bit of a however there. And the however is that the court emphasized there's nothing in our opinion that should be taken to cast doubt on longstanding prohibitions on the possession of firearms by felons and the mentally ill. Now, this harkens back to the prohibitions that were established in the 1968 Gun Control Act, the year that Senator Bobby Kennedy and Dr. Martin Luther King Jr. were assassinated. We're going to talk about that in a little bit. So those prohibitions that said people who have a felony criminal conviction or have been committed to a hospital, those can stand. So what that means really is that there's now a focus on dangerous people. It means that gun control in our country is not really so much about guns. It's kind of people control. It's how we decide who shouldn't have access to a firearm. And that is very difficult to do because violence is complicated. It's caused by many different things. People are complicated. We don't always know who the dangerous people are. But that's what we have to kind of struggle with. So we do have some regulation, some variation from state to state in how restrictive gun laws are. Do those work? Well, you know, one way of looking at that is to look at the Brady campaign scorecard, named for Jim Brady, who was President Reagan's secretary and press secretary and was injured and eventually died in the assassination attempt of President Reagan's life, and was influential in getting the Brady Law passed later, which required background checks for gun purchasers from a licensed dealer. So the Brady campaign has a scorecard and basically goes from 0 to 100, and it codes each state. It gives them a scorecard on firearms trafficking, you know, how restrictive the laws are in terms of penalties and enforcement for gun trafficking, whether background checks are required. Some states have universal background checks. Child safety, you know, you're required to lock up guns and so on. Whether certain kinds of weapons like military-style assault weapons and high-capacity ammunition magazines are allowed or not, guns in public places. So we can look at that, and again, here is a kind of a scatter plot. What you see over there on the vertical axis is, again, the CDC's reported firearms fatality rate per 100,000, and on the horizontal x-axis is the state law gun restrictiveness, the Brady scorecard. So look at there, you have a kind of a linear correlation that the states with more restrictive gun laws have lower fatality rates. Now, it's not so simple as saying, okay, well, maybe that's, what we should do is make sure all the states over there that are high should have more restrictive gun laws, because this is not a causal connection necessarily. It's a correlation. But we don't necessarily know which direction the causal arrow is going. There's a third variable, and if you plot that here instead of state law gun restrictiveness, look at the household gun ownership rate. Excuse me, let me take a sip here. And it turns out you get a graph that looks just the same as the one I just showed you. So the causal arrow could be going like this. There's, a couple of different hypotheses. One would be hypothesis A. More gun regulation leads to fewer gun deaths, and it maybe is sort of mediated by this variable here. More gun laws means fewer guns, and that leads to fewer gun deaths. That could be the case, but maybe it's something like this, that upstream there is variation in public attitudes and the cultural acceptance of guns. Some states have more of a gun culture than other states, and maybe states like that tend to do two things. They have more guns, and they also are resistant to gun regulation, so they have less restrictive laws, and then what you get is something like this. States with more guns have more gun deaths. They also tend to have lower regulations, but there's not necessarily a causal connection there between the gun laws and the gun deaths. So we don't necessarily have the data to test that, but we can kind of do a couple of things. And one is to look at the relationship between the strength of the laws and the fatality rate stratified by the level of sort of gun saturation in states. So you see here three groups of states. One on the left there is states where between 0 and 35% of households have guns. And then the middle is sort of a medium rate, 35 to 50%, and on the right is over 50%. So what you see there is that there's a very strong relationship between the strength of the laws and the fatality rate related to guns in states that have fewer guns at the household level. As you move to the middle group there, it sort of decays a little bit, goes from 0.63 to 0.44. That's a correlation coefficient. And when you get out to the states with more than 50% of the households having guns, there's no correlation at all. We can't really tell, though, because look at the ranges. The ranges here on the left goes from 0 to 100 on the Brady score. In the middle, it goes from 0 to 25, and on the right, it only goes from 0 to 10. So every single state there gets an F on the Brady scorecard. So we don't really have any examples of states that both have a lot of guns and have strong laws. But just an example of how this might work. Think of a law like requiring a waiting period, like a 5-day waiting period to buy a gun. If you go to, let's say someone gets very depressed and they want to get a gun to end their life, they go to a licensed retailer and they find out there's a waiting period. Well, that might deter them unless they live in a state where it's highly likely they've got 6 shotguns at home already, and then it probably won't. So that's an example of how this might work. So we have a problem with firearm fatalities and injury in the United States. When do we pay attention to it? We pay attention to it in this country when there is a tragic mass casualty shooting by a disturbed young man. And probably the most extraordinary example of this in recent times was Newtown, Connecticut, Sandy Hook Elementary School, December 2012. 26 school children and some of their teachers massacred by a very disturbed young man with access to firearms. And that incident really spawned this wrenching public conversation. And all of these unanswered questions was, what was this about? Why did this happen? Was it really about the guns? Was it about unregulated firearms? Was it about our violent culture? Was it about mental illness, untreated psychopathology? And what you heard following this incident was just a whole series of voices actually kind of linking gun violence to mental illness. And here's one example. Representative Tim Murphy from Pennsylvania, he recently issued a press release, and look at the juxtaposition here. There was Elliot Rodger in Santa Barbara, Jared Loeffner in Tucson, James Holmes in Aurora, Colorado, Aaron Alexis at the Washington Navy Yard. How many more must die before we finally deal with our broken mental health system? Very explicit connection between a broken mental health system and mass shootings, and by extrapolation, gun violence. And of course, Representative Murphy is proposing at the federal level, H.R. 3717, a law that would, among other things, require states, as a condition of getting block grants, to expand involuntary outpatient commitment. Very controversial policy. But, you ask the NRA boss, Wayne LaPierre, what he told David Gregory at Meet the Press after the Newtown incident. We have no national database of these lunatics. That's what he said. He's referring to people with mental illness. He's not referring to gun owners. That's a different story. He is vehemently opposed, stridently opposed to a national database of gun owners, but he would like to have a national database of what he calls lunatics, people with mental illness. That's why he thinks, that's the problem. It's not about the gun, so let's talk about people with mental illness. A mainstream journalist, Joe Klein, wrote in Time magazine, I'm worried about what happens if we do pass universal background checks, because we'll think, well, we've done something about this problem of gun violence, but we will not have addressed it because it doesn't address the most significant piece of the problem, which is what? The mental health issue. Right? That's the problem, according to Joe Klein. He's not some kind of a radical. He's actually someone who is in favor of gun control and so on. Dr. E. Fuller Torrey, who founded the Treatment Advocacy Center. He says civil libertarians have made it impossible, almost impossible, to treat psychotic individuals who refuse care. These misguided activists, he calls them, have created a morass of legal obstacles that prevents us from helping many psychotic. And so, as a result, it's sort of interesting. If you look at the outpatient commitment laws that have passed in this country, I'm showing you pictures of three men here, Andrew Goldstein, Scott Harlan Thorpe, and Brian Williams, all of whom were diagnosed with schizophrenia eventually. And why am I showing you their picture? Because each of them committed an act of homicide, a very highly publicized act of homicide, and the victim in the homicide in each case became the namesake for an eponymous outpatient commitment law. So we have in New York, Andrew Goldstein pushed Kendra Webtail in front of a subway train, and we have Laura's Law, enacted in Kendra's Law in 1999. Scott Harlan Thorpe went into a behavioral health clinic in Nevada County, California, and shot Laura Wilcox and others. And we have enacted in 2001 Laura's Law, a mandatory outpatient treatment law. And Brian Williams killed Kevin Heisinger with his fist in a bus station in Michigan. And we have Kevin's Law. Now notice these aren't named Andrew's Law and Scott's Law and Brian's Law after the people. They're named after the victims. But there's a very provocative question here that these cases invite, and that is this. Would Kendra's Law, Laura's Law, and Kevin's Law have saved Kendra and Laura and Kevin? I don't think so necessarily, because each of these people, it's not that they were refusing treatment. They were actually trying to get treatment. They just were unhappy with the treatment that they were getting. And in Andrew Goldstein's case, he actually wanted to get into the hospital. But you can't deny that these laws wouldn't have passed. This is how they got passed, by building public support on the basis of public fear of people with mental illness and linking explicitly mental illness and violence. National opinion poll following the Sandy Hook shooting. Do you favor or oppose increasing government spending on mental health screening and treatment as a strategy to reduce gun violence? General public, 60%, yes. NRA members, 57%. So people who disagree on the politics of gun control, and we've heard a lot about that today, millions of people with serious and sometimes disabling mental health conditions are not getting treatment. We have mental health care systems at the state level, some states worse than others, that are fragmented and under-resourced and overburdened and don't work very well for people. And as a result, maybe, we have lots of people in the criminal justice system, as you have heard from Allison, with mental illness. It costs our society $318 billion a year by one economist estimate. On the other hand, we have gun violence in America, and we have, this is also a very costly problem, responsible for the deaths of over 33,000 people every year and 81,000 non-fatal gun injuries, and that costs our society $174 billion, according to Professor Ted Miller's recent estimate. And there's this little wedge here where they come together, just a little wedge, but that wedge becomes a kind of a prism through which we view both of these problems. And we see the mass shooter. That's really unfortunate because the mass casualty shooter, the mass shooter, is atypical in two ways. Really atypical of people with serious mental illness, the vast majority of whom are not violent and never will be violent towards others. And they're really atypical of people who commit gun crimes because most of those people do not have mental illness. But that's how we end up seeing these problems, and that's how we end up talking about them. That's the conversation that we're having. So the General Social Survey has found some years ago that 60% of adults in this population believe that people with schizophrenia are likely or very likely to be violent. Just imagine that you came from Mars and you didn't know anything about schizophrenia except for what you saw on television while watching crime dramas. You'd think that every single person with schizophrenia was a kind of a, homicidal monster. That's what you'd think, because that's how people are portrayed in the media. There we've got the Martians watching television, so that's what they think. And it's unfortunate for a couple of reasons, because people act on the basis of what they believe to be true. So if you believe that people with schizophrenia and mental illness are dangerous, what? You're going to want to be distant from them. You're going to treat them with scorn and fear. And in the end, you might discriminate against them. And you might support public policies that restrict their liberty, even if those aren't necessarily effective or fair. And discrimination, that's going to basically deny people some of the same opportunities that we all have, to participate in the benefits and the rights and the opportunities in our society. And there's a real disconnect with the science. Because if you look at what the scientific research says, it basically says, if you look at absolute risk, now that's just the proportion of people with a risk factor who are going to do something violent in a year. And that might be something as minor as pushing or shoving someone or slapping someone. We're not talking about, a mass shooting. It's about 7%. Now, this is factoring out substance abuse, just people who have mental illness without substance abuse. There's a relative risk of about 3.5, but it's a low base rate phenomenon. So you can have a high relative risk and still a low absolute risk. The attributable risk, that means, what proportion of the problem of violence in society is attributable to mental illness, and that's about 4%. And the rate of victimization is 25%, which is to say that people with serious mental illness are far more likely to be victims than perpetrators of violence, and more likely to be victims than other people who don't have mental illness. So just to emphasize this, that little orange wedge there, if we were to wave a wand and magically cure schizophrenia, bipolar disorder, and depression, that would be wonderful for other reasons. But 96% of our violence problem would still be with us. And if you think about that in terms of the gun violence issue, on the day that the children were killed at Sandy Hook Elementary School, and everyone was just so focused on that, that same day, approximately 85 other people died in the United States as a result of gunshot, and 85 the day before and the day after in domestic violence incidents, gang shootings, suicides. So, does mental illness cause violence? If you think about it this way, this kind of a chemical reaction, like if mental illness, then violence, like you could reduce this to some kind of a mathematical equation, the answer is no. It's really kind of more like this, like these dominoes here, where you have multiple precursors and like upstream from genetics to the social environment and the personality that you develop, what you're exposed to growing up as you're kind of laying down your permanent brain circuitry and how you learn to adapt to stress and things like this. And then there are all of these kind of co-determinants like substance abuse and things that happen to you that might, like provocative incidents and so on. And then what happens is this results in a huge amount of kind of uncertainty. So, there's no shortage of pundits and experts out there who will tell you after a mass shooting, well, this was predictable. And, you can predict it. It's not that hard. I can tell you how you do this. All you need is this remarkable device called a retrospectoscope. And if you look through your retrospectoscope at this, then it's just amazing what you can see. It looks crystal clear. The problem comes when you flip it over and you point it out into the future and you try to look prospectively and predict who's going to be violent. And then at that point, everything kind of turns to fog, because even trained psychiatrists using structured risk assessment instruments, it's not much better than a coin toss when they predict which of their patients is going to be violent. 0.41 is from a meta-analysis. That's the percentage of positive predictions of violence that are right, across all of these different studies. Now, psychiatrists are a little better at ruling out who's not going to be violent, but in general, it's not very predictable, because the risk factors for violence are kind of nonspecific, and they're shared by many more people who are not going to do the violent act than who are. So, you'll get a picture, if you look at it after the fact, of a young male who's troubled and isolated and maybe has some delusions and so on, and that describes tens of thousands of other troubled young men who aren't going to do this. So, does that mean that, we should just sort of give up and say mental illness and gun violence are not related at all? Mental illness is irrelevant for thinking about reducing the problem of firearms injury and mortality? No, for a couple of reasons. One is, there actually are times in the kind of career of illness and treatment where we do know that risk is elevated. And so what you see here are these bar graphs are, again, a meta-analysis. This is an average across all these different studies that have been done of the prevalence of mental illness in people, the prevalence of violence, in people with mental illness, organized by the settings in which these studies have been done. So you see there on the vertical axis, that's the percentage who have been violent, serious or minor violent, any kind of violent act in a 6 to 12-month period. And along the x-axis on the horizontal line there, those are the settings. So the general population without mental illness, for comparison, that's 2%. Outpatients in treatment, maybe 8% would do something violent in a year, which is to say, 9 out of 10 won't. Now, when you start to get into the studies that have been done in settings in which people encounter the mental health care system in a crisis, now the rates are higher, okay? Emergency departments, 23%. That's not surprising necessarily. That's maybe why people come into emergency departments. Is there some risk of harming others or themselves? Involuntarily committed patients, 36% in the lead up to involuntary commitment. Not everybody, but 36%. Now, again, that's not surprising because the criteria for involuntary commitment are kind of intertwined with dangerousness. And first episode psychosis patients, 37%. Now that's interesting also from a policy point of view, because if our approach to limiting access to firearms is to comb through records and look for red flags or look for something like a history of a mental health adjudication and say you can't have a gun, these are people who are not even in the system. They don't have a record necessarily, so we would need probably a different approach. Well, why not focus firearms restrictions on these kind of specific times and behavioral indicators of risk? Talk about risk rather than mental illness per se. And we'll talk about that. So the other reason is suicide, because it's certainly true that, mental illness contributes very little to homicide overall, but contributes a lot to suicide. It's a very strong vector. And you see here this pie chart from 47 to 74%, depending on the study. That's the attributable risk of suicide that is really connected to mental illness. So the blue wedge is people who commit suicide for other reasons. But it's a huge connection. And what happens is that, suicide is often the impulsive act of a young, distressed, intoxicated person. And it's as they say, a permanent solution to a temporary problem. And if you can intervene and someone survives a suicide attempt, they're unlikely to go on and die from suicide. They're going to probably die from something else. But if they use a firearm when they try to hurt themselves, they won't get that second chance. You might survive an overdose. You're not going to survive a gunshot directly to the brain with nobody there to call 911. The case fatality rate is almost 99%. And surviving a gunshot to the brain is also maybe a Pyrrhic victory, because many people have lifelong disabilities. So there's a big public health opportunity there. because most of the firearms deaths in this country are suicides, and a lot of the suicide has to do with mental illness. So how does our current law actually approach this? Well, the federal law categorically excludes some people with mental illness from accessing firearms. And you see here 18 U.S.C. 922D is these are the criteria we've inherited from the 1968 Gun Control Act that I mentioned earlier. And there are kind of two prongs to it with respect to mental illness. The first is you're prohibited from possessing or purchasing a firearm if you have been committed to a mental institution. The thinking there is, well, if you've been committed, maybe there's dangerousness there. And also you've been afforded due process protections that would be consistent with the deprivation of a constitutional right. And so the way it was originally set up is that was kind of a lifelong prohibition. So, you could have had a suicidal episode 25, 30 years ago, totally recovered from it, had no problems for 25 years, and you're still prohibited from, firearms. If you want to get a job as a security guard and have a gun, you can't because you're a prohibited person. The second prong is adjudicated as a mental defective, and this is kind of a little bit of an insulting phrase that doesn't mean anything clinically, and people would like to get rid of it, but what it means legally is that there's been an authority that has determined that someone is dangerous or incompetent to manage their own affairs, or in a criminal matter that they have been found incompetent to proceed, to stand trial, or acquitted by reason of insanity. So the question, is this. I mean, if you ask people, well, why would we have these laws? Probably the average person would say, well, this is to protect ourselves from, people like Adam Lanza and Jared Loughner and James Holmes, who, shot up people in the movie theater, or Cho, who killed, 30-some of his fellow students at Virginia Tech. But the real question is this: can these laws actually succeed in keeping guns out of the hands of people like this, when people with mental illness actually look like this, like everybody in this room? I mean, people with mental illness are people who share all the same risk and protective factors for violence as anyone else does, and might range from, your harmless grandmother to your neighbor's not-so-harmless intoxicated boyfriend and everything in between. So, is this the answer? Lots of people think the answer to this is, well, let's just put more and more and more gun disqualifying mental health records into the National Instant Criminal Background Check System, which was established as part of the Brady Law. That you have to have a background check, and then we're going to have states report all these records to this. And you can see, it's kind of interesting that the NICS index, the National Instant Check System Index, the number of mental health records has just increased exponentially, and it kind of has tracked these mass shootings. So if you look at 2007, right before the National Instant Check System Improvement Act was passed, there were about just short of 300,000 of these mental health records in the NICS. By the time we get to the Sandy Hook shooting 2012, it's 1.8 million, and then it doubles again to 3.2 million in 1 year from 2012 to 2013. Well, does that work? Does it have an effect? Is that the answer? Well, it's kind of hard to think so when you contemplate this. More than 99% of all those mental health records in the NICS have not resulted in a federal gun denial. So there's a lot of trouble everybody's going to get all these records in there, and it's actually not doing a lot to deny people guns. So background checks may be important, but there's just not enough for some reasons that I'm going to talk to you about, and it might be a little bit of a wrong emphasis. So the problem with the criteria that we have, it can be sort of illustrated as follows. You have these three problems here that intersect. I mean, they're not isomorphic. Three different circles: suicidality, interpersonal violence, and mental illness. And this is kind of what our federal gun restriction criteria do, that dotted circle there, based mainly on involuntary commitment. And of course, you can see from this diagram, the problem is that it's both under-inclusive and over-inclusive at the same time. It's going to scoop up a lot of people who are mentally ill but are neither violent nor suicidal. And it's actually going to fail to get some people who are violent, who might be inclined to harm themselves, but haven't been involuntarily committed. This is flashing here in front of me, so. All right. The other problem, if you think about it, is that the federal criteria that have to do with involuntary commitment are nested in what states do with their involuntary commitment policy. And states are all over the place about that. There's huge variability in how commitment criteria are actually implemented. And with the results you can see here from state to state, according to some recent survey data from the National Association of State Mental Health Program Directors Research Institute, the range in terms of patients admitted voluntarily goes from 1 to 79%, and percent who have been involuntarily committed goes from 2 to 98%. So your chance of being committed and thereby prohibited from a firearm is actually going to depend on what state you live in. You know, if you live in one state, you might have a big chance, in another state not. So here's another aspect of this that's important with respect to current policy. What you see here, these two, first of all, two big circles. There's a big circle, and that's the number of people who have been subjected to a short-term involuntary hold in a mental health crisis. So they've been transported and detained under one of these kind of short-term hold laws and admitted voluntarily, but they haven't necessarily had a commitment. There's a lot of those, and the number of those that actually progress to a gun disqualifying commitment is not very great, so it's only 41%. So the other thing is you see is that, so a lot of people get transported in a crisis and don't get committed. The other thing is that the orange wedge there represents the percentage of those that take place in private facilities, private hospitals, and the blue wedge is what happens in state facilities. Now, lots of states, when they report their records to the National Instant Check System, only look at the state hospital records. They don't have access to all these private facilities. And so a state's been privatized. Your chance of getting that record that would disqualify you from buying a gun into the background check system is going to depend on whether you have insurance, private insurance, and get admitted to a private hospital, or whether you go to a state facility within the same state. So, and here's another aspect of this. And so this has become particularly, I think, poignant to think about in the light of our recent tragedy in Chapel Hill with the 3 young people who were shot a couple of weeks ago. These data here this is analysis from a nationally representative survey of over 5,000 people, and what we are estimating in this paper, which is forthcoming, is the juxtaposition of 2 things. Number 1, pathological anger traits. People who have impulsive, angry behavior. They're the kind of people who, when they get angry, they blow their stack and they break and smash things, or they get into physical fights with people, and access to firearms. So really angry, kind of pathologically angry people, and they have guns. And so the estimate here is, again, think about your town of 100,000 people, population unit of 100,000 adults. Approximately 10,000 people in that 100,000 would have some of these kind of anger traits, impulsive angry behavior, and have guns at home. And approximately 1,600 would have a gun they're carrying around with them in public, and they have this pathological kind of anger. So you think, well, that's kind of a bad combination. Are those individuals mentally ill? Well, that depends on what you mean by that, because it turns out that according to the survey, lots of them meet criteria for a mental illness as defined broadly in the diagnostic manual of the American Psychiatric Association. It's not things like schizophrenia, bipolar disorder. What it is things like personality disorders, antisocial personality perhaps, anxiety, lots of alcohol use, excessive alcohol use. There are a range of things, but they're not the kinds of illnesses for which people get involuntarily committed. If you wanted to look at that, that little orange bar at the top there is the percentage of individuals in those categories who have ever been in a hospital for a mental health problem, let alone getting involuntarily committed. So it's only 13.2% of one and it's 16.3% of the other category, which means the vast majority, maybe 8 out of 10 of those kind of angry people with guns, unless they've got some kind of other disqualifier like a felony conviction, can walk right into a licensed gun retailer and buy a gun. And the shooter in Chapel Hill last week, if you saw the reports, 14 firearms were seized from his home. So, how do we think about these individuals? Well, what about, restrictions that are based on actual indicators of risk? It turns out a lot of these individuals may have criminal records for something like a misdemeanor assault, which in many states does not disqualify people from guns. Or they might have been a respondent or subject to a domestic violence restraining order that's temporary, in a high-risk period of time, that's not disqualifying. Or they might have multiple DUIs, DWIs. So there might be a way to think about other prohibitors. States could take those records and put them into the background check. It might get some of these sort of angry people with guns. So what about the current law? Does it work or not? Well, we actually did one of the only research projects that has addressed the question of whether the current criteria, as they're implemented in states, that they're designed to deny people with this mental illnesses under certain conditions access to firearms, does that work? What you see here in this slide is two trend lines, a red one and a blue one. And what's represented here as you move from left to right is the probability, the predicted probability from a big statistical model of a violent crime, month by month by month, from 2002 out to 2009. Well, you can see that before 2007, the red line is higher than the blue line. Now, what's different about the red line? The red line are people who have been disqualified from firearms because of a mental health adjudication. They've been involuntarily committed. The blue line are their counterparts, same illnesses, same system, but they've only been admitted to the hospital voluntarily in Connecticut so they can buy a gun. And we've taken out people with a criminal disqualifier just to be able to compare people in their exposure to this policy. Well, something happens in 2007, right? The lines start to come together. And this is a picture that's drawn by the computer model. So it kind of is a caricature a little bit. It's like, what's the best model that fits these data? And you can see those lines come together. 2007 is when Connecticut began to deposit thousands and thousands of gun disqualifying mental health records into the national check system. So before that time, you could walk in and you could buy a gun, you could lie and buy. You could say, have you ever been involuntarily committed? No. After that, you're going to fail a background check system and you might be deterred. So something happened. You might say, well, that's good news, that works. But look at this. It only affected 7% of the population of people with serious mental illness. So the vast majority of them were not exposed to this. So it's kind of like saying, well, we've got an effective vaccine for a communicable disease in the population, but we're only going to vaccinate 7% of the people. It's not going to necessarily have a big impact on the population problem, although it might have an effect for those people. And secondly, 96% of the violent crimes in this sample were committed, or this population of people with mental illness, were committed by people not affected by the gun disqualification and reporting policy. And what was it that was associated with violence? Well, it was the same factors that are associated with violent crime in the regular, non-affected population. Being young, being male, being disadvantaged, misusing drugs and alcohol. Here are the results. We've done the same study now. We're just about to produce the report in Florida. And these are data from 81,704 people in Florida with serious mental illnesses. And what you see in this table is the percentage of people over this 10-year period of time who were disqualified from firearms. So 12.82% had a mental health disqualifier. And I'm going to have to look at this because this is... and 28% had any criminal or mental health disqualification. 72% were not disqualified from firearms, could legally buy a gun anytime during that period of time. Now, this is an especially interesting one because these are individuals who were not disqualified from buying a gun. They could buy one, but they have had an involuntary examination under Florida's Baker Act. So they've been transported in a mental health crisis and probably involuntarily admitted for a 72-hour period. Then they have been released or they have signed involuntarily, never lost their gun rights, but they have been identified during that period. So a way to kind of get to what the problem is, I think, and we're better at describing the problem here than we are telling you what the solution is so far, but we're going to get there. These two pie charts represent all the people in our study who ended their life with a gun. So there are 50 gun suicides, that's on the left, and 1,206 people who were arrested for a violent crime with a gun. And what these wedges are is the percentage of people who were disqualified or not from buying a gun at the time this adverse event happened. So you can see here on each side, with respect to the 50 gun suicides, and it's a number, but just keep in mind, it's also 50 people, 50 stories, 50 individuals who ended their life with a gun and left their family members and loved ones behind, and maybe that was preventable. So 72% of them were legally able to buy a gun at the time that they used one to end their life. On the other side, looking at people arrested for a violent crime with a gun, 38% of them were not prohibited at the time, could buy a gun legally. And the counterpart to that, the flip side is on the suicide side, 28% were gun prohibited at the time, and 62% of those who were arrested for violent crime were prohibited. So there are two problems. The problem on the bottom is the problem with our criteria, right? If we had better criteria, we might have been able to identify those individuals at risk and deny them the right to have the gun that they used, either to harm themselves and kill themselves or to perpetrate a violent crime with a gun. The problem at the top is these are people who could not legally buy a gun, and they got one anyway. How did they get one? Maybe they already had one. Maybe they bought one on the secondary market. Maybe they went to a gun show. That's a problem with our enforcement, with the actual implementation. And fixing the criteria is not going to fix that problem. That might be a problem with universal background checks, right? If you have 40% of the gun transfers are taking place outside the background check system, people can just go get a gun otherwise. It's like having two lines at the TSA when you go get on a flight. Here's one for people who really want to take off their shoes and their belt and their put their laptop in the screener. But here's another line. If you'd like to, just walk through that one. There's no screening at all. So that's kind of how we do, gun sales in this country. So, and here's kind of the punchline here for suicide. Of those 50 people who ended their life with a gun, these are all people with serious mental illness, only 6 had this gun disqualifying commitment, but a lot of them had this Baker Act hold that didn't progress to a gun disqualifying commitment with a judicial hearing and where they'd be represented by counsel and so on. So 34 of them had that. There were 29 Baker Act holds in the year, among the 50 people before the suicide, and 106 totally in this population. So that, invites this question: what if these involuntary hold events had conferred a temporary restriction of firearm rights with removal from the home? Maybe that could have saved some of these lives. So I'm part of a group called the Consortium for Risk-Based Firearms Policy that includes some of the nation's top experts in gun violence prevention and mental health and some practitioners and some stakeholders. And what we've done is come together to try to come around a consensus for what we think the evidence suggests that state policymakers should do and federal policymakers. And so we have issued these 2 reports. And I'm going to share with you our recommendations for state gun policy. So what we think basically is we should get away from, this is what we call the kind of mental health reframe. Let's not think about mental illness and diagnosis as like that's the big problem. Let's think about risk. Let's think about actual behavioral indicators of risk. History of violence is a way better predictor of future violence than a mental health problem is. So, and here are some things, as I've mentioned before, that might actually work. Violent misdemeanor convictions, temporary domestic violence restraining orders in the period before it might become permanent, 2 or more DUIs, DWIs, these are things correlated, and I'm listing them sort of in the order of the strength of evidence for these things. So, I feel much more strongly about the first one, violent misdemeanor convictions, and we've got evidence from California that actually works. Some states actually do prohibit from firearms any violent misdemeanor, and other states don't. And then on the mental health side, as I've said, what about having a temporary restriction for people with one of these short-term involuntary holds, even if they haven't yet been committed? But then, very importantly, is that if we're going to tinker with the prohibitors and make that category a little more elastic, we also have to think about the fact that there's a constitutional right at stake, and we have to pair that with a meaningful and expedient and hopefully clinically informed opportunity for people to get their gun rights back when they no longer pose a threat to public safety. And then the last one is really about the fact that we've got a lot of guns out there, and we have a lot of people who are dangerous, maybe really angry, and just stopping them, thwarting them from buying a new gun isn't necessarily going to deter them from using a gun for a harmful act if they already have access to a lot of guns. So, and there are a lot of people like that who, they're not committable, they're not criminally accused, but they're kind of dangerous, and family members are in a good position to know that. So there are 2 states, Connecticut and Indiana, that have enacted what are called dangerous persons gun seizure laws, where that gives a tool to family members and law enforcement to remove guns, separate guns from people who are dangerous, with some due process. So the states differ. Connecticut requires a warrant, to get an expedited warrant kind of in real time to do this, and they have to meet probable cause and so on. In Indiana, it's a warrantless seizure. Guns can be actually taken away pending a judicial hearing. It's supposed to happen in a couple of weeks, and sometimes it doesn't happen for a few months. But those are kind of two examples, two kind of species in this larger genus of gun removal laws. And the latest example of this is what our group is proposing as a gun violence restraining order. And that's a law that California has just enacted in the aftermath of the Elliot Rodgers shooting in Isla Vista. What that does is it uses the kind of legal platform that every state already has for a domestic violence order of protection, and it says, let's use that process to remove guns from people who are dangerous. And that's a law that's kind of getting some traction around the country. So we don't know what every state should do. People sometimes say to me, well, what's the one thing you should do to reduce gun violence? And it's not a one-thing problem or a two-thing problem. But there are some principles to guide these policy reforms. And I'm going to kind of end with this. The first one is to prioritize contemporaneous risk assessment based on evidence of behaviors that correlate with violence and self-harm at specific times, not this mental illness or treatment history per se as a broad category of exclusion. Number two, preempt existing gun access for reasons that I've just mentioned, rather than just stopping someone from a new gun purchase, which is not necessarily going to be effective at deterring the act of harming others or self. Third, provide legal due process for a deprivation of gun rights, because there is a constitutional right at stake, and we don't want to infringe on the rights of lawful gun owners, just as much as we don't want to stigmatize people with mental illness. Fourth, preserve confidential therapeutic relationships. I mean, the private, confidential doctor-patient relationship, confidentiality is the bedrock of that. And if people can't confide in their clinicians, and that might have a chilling effect if they think, I'm going to be reported to the police if I go to disclose to this doctor what I'm really thinking. That might drive people away from treatment. It might inhibit people's disclosures in therapy and actually have an adverse unintended consequence. That is kind of hard to undo. So we need to think about this, because there are these kind of crisis-driven laws that are going to rush to say, well, let's just, deploy all the mental health professionals out there to surveil people and report people that they think are dangerous to the gun data set. We need to think very carefully about that. And last, we can't necessarily predict who the next mass shooter is. As I've said, it's not very predictable. Maybe it's a needle in a haystack. But there are ways we could prevent the unpredictable. And one is to think about violence as a communicable disease in a population. What if you thought about it that way? You'd kind of try to get upstream with a full prevention model and think about how we have healthier communities, fewer kids exposed to trauma and violent victimization who grow up to be perpetrators. What if we thought about improving the social safety net as a violence prevention strategy, or improving people's access to substance abuse treatment? Spend some of the money we're spending on incarcerating people and interdiction and make substance abuse treatment more accessible. If we did those kinds of things and also did a better job on the far end of limiting access to lethal means, we might eventually, it's not going to be overnight, it's going to be a long-term project, and it's going to outlast the elected term of office of a lot of people in office right now. We might live in a less violent society. And we're not going to see a dramatic headline in the New York Times one day that says, better social safety net, better mental health care system, prevented mayhem on Thursday, because the thing that doesn't happen doesn't make the news. But if we did have that result, why would that matter? So thank you very much. And I'm happy to answer a couple of questions if we have time. Professor?
Can you imagine how this kind of new and more recent focus on anger as a more problematic risk factor for gun violence than mental illness, how that might be applied? So it's being, it's subject to the dangerous persons gun seizure laws in Connecticut and Indiana, presumably, and with California's gun violence restraining order. Can you think of that there might be a possibility of somehow including that in prohibitions related to background checks?
Well, I think it's tricky because, you can just imagine the pushback.
Sure.
Right? Just imagine an argument like this. So are you really saying that everybody who's angry should lose their Second Amendment rights? You know what? I blow my stack sometimes. Sometimes I lose my temper. Sometimes I slam a door. I own a shotgun for pheasant hunting. I would never think of using it to hurt a person. But yeah, I'm kind of a hothead. Should I lose my Second Amendment rights? So we have to be very careful about extrapolating from this kind of trait that we've studied in the population, that's, again, kind of nonspecific. So I think really, I like the idea of the dangerous person's gun seizure laws kind of being a little fail-safe there, because you have to have people who recognize that this person here actually is scary, and we're worried about them, and they have access to guns. And that then, having, again, the kind of due process there where it has to be considered, first it has to be sort of probable cause, and then there has to be the judicial order and the GVRO. So I think it merits some further study, but I don't know how you'd actually operationalize, anger as a prohibitor, because it's not like, we don't even do that with mental illness. Some states try, but we actually say, that's why we say you have to be involuntarily committed, because at least that's some kind of a threshold. It's a problematic one. But that is, it is provocative, I think, and it's an interesting question. Anyone else? Jim? Yeah.
The road rage incident ended up the woman getting killed, the gunfight between her son and the other person, and then the discussion about, I think last night said why you shouldn't carry a gun in your glove box. Right. And it was specifically people carry guns in their glove box are more likely to be angry, road rage.
I think that's right. I was listening, maybe some of you heard it, last night, the interview on the Frank Stasio's show with Professor Joe Kennedy at UNC, who's a criminal law professor at UNC, and he was talking about the Chapel Hill case, but one of the things he said that stuck in my mind is that there's like about a third of homicides in the United States that actually occur because of arguments. Stupid arguments that don't make it very rational, but if and my friend Harold Pollack has this kind of actual equation. He says this is the formula for gun deaths. You take a young man and another young man, an argument, and a gun, and it's going to equals a dead body. A lot of times that's what happens. He's talking about what happens in Chicago. So that's the thing. Gun violence requires two things: a dangerous person and a gun. We're never going to live in a world without people inclined to harm others or themselves. It'd be nice, but probably won't. If we did, we could have lots of guns and we wouldn't have gun violence. But that's the issue. Sure, we should try to do something about pathological anger, but in the meantime, thinking about how to separate such a person from a firearm is very challenging. But I think that is again a population health opportunity.
In terms of like Adam Lanza, I think that was his mother's guns. Is there any discussion about not just the person buying the gun, but do you have a family member or a household member that has these issues? Because I think in some of these situations, it hasn't been that person's gun, especially the young people.
Exactly, and right. You could all of the new laws that were passed in Connecticut, wouldn't necessarily have prevented that because the guns were. He couldn't buy a gun anyway. He was underage. Right. So. I think that this is one of the more controversial aspects of gun seizure laws, but I think it's, in order for it to be effective, you have to think about the whole, residential or household environment that someone's in. And I heard an anecdote from somebody once in my travels who was very much against this kind of thing. He was a libertarian and very opposed and kind of, believed in kind of this insurrectionist idea that we need guns to protect ourselves from a tyrannical government. So, but he told me this story. He said, my ex-wife had bipolar disorder, and one time she got so, kind of amped up that he said he called the police. The police came. They took her away. She was involuntarily committed, But then they came back later, he says, and they seized all 18 of my firearms. So they were his guns, and he was outraged because they were taken away from him because she was going to come back to the household. And then, and see, he said, look, I haven't committed the crime. I'm not mentally ill. These are my guns. They're legally registered to me. So you might come to a different conclusion on that if you take this kind of, strong, civil libertarian view versus the kind of public safety view. Because from the point of view of public safety, it doesn't matter who they belong to. If they're in the house, the person has access to them, they could be used. And as the Adam Lanza case illustrates. So, I think the answer to that is, to have these gun removal regimes be temporary and have an opportunity for them to be rescinded, if the evidence merits that. But they should actually remove guns that a person has access to in the home if they're going to work. Dan?
Yeah, I was wondering whether or not the consortium or the evidence you've drawn from has any implications for concealed carry laws and concealed carry permits. Just any thoughts on that? If they're a bad idea.
Yeah. Well, I don't really have any evidence that I can bring to that, except to say that, if you are in a state that allows a concealed carry or any kind of carry, but where the person has ready access to the gun, it's just going to dramatically increase the probability that when some provocative episode happens, like if you get in a fight and you go, I'm going to go home and get my shotgun out of the thing and come back, and that's a little different than saying you got a gun in your pocket and you're going to pull it out impulsively, in an altercation. So, just on the face of it, it's an increased risk. So I think what the consortium is trying to do is think about, are there gatekeeping opportunities? There's an interesting one in North Carolina where if you apply for a permit, you have to actually provide a medical record release and allow the county sheriffs to write to your doctor and ask the doctor whether you suffer from some physical or mental condition that would prevent you from safely operating a handgun. Doctors don't necessarily have any idea what that means. What does competence to operate a handgun actually mean? So there needs to be maybe some more education about that, some criteria, right? Are there some criteria that might be different where we need to think about access to that? Because, just on the face of it, and in certain, places like college campuses, having children myself who've recently graduated from college and kind of understanding the species a little bit, to me it doesn't sound like a good idea to have college students running around with guns. Because then the professors are going to want them too, and then God help us all, so anyway.
All right.
Thank you very much.
Thank you.